Hello, everyone. My name is Joanna Lindsay, and I wanted to come to you today to talk about problem-based learning, along with two other of my colleagues. And it's very important to understand that problem-based learning can be very realistic. It can happen in the clinical setting. It can happen in the classroom setting. It can happen in everyday life. We go through problem-based learning every day. Problem-based learning is designed around a problem and how it gets solved. And it's usually realistic in nature. As we know, we're coming to the end as seniors, which is great. Yay, 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 yay. I'm excited about that. I know y'all are too. Um, it's very important for us to understand that we're going through problems each and every semester, whether it's personal, whether it's class related, whether it's anything, but we're making it through. So we're learning how to solve those problems efficiently and move forward. So that's why it can become very realistic. And as our students understand, they will have problem based learning as well, and that's utilized as they make decisions regarding their patients and decisions regarding the objectives of their patients and how to meet goals of their patients. Um, but the general outcome for problem-based learning is to be to gain extensive and flexible knowledge base. That's very important. Develop effective problem-solving skills. Very important. Develop self-directed lifelong learning skills, which is also important. We do have these lifelong skills that sometimes we do not use. Also, become effective collaborators. If you cannot communicate to your colleague, if you cannot communicate to your patient, if you cannot communicate to help solve a problem, then we have to learn those skills and becoming extrinsically motivated to learn. That is a part of the goals of problem-based learning. And as an educator, we can utilize this for our students through case study, Sims lab, and discussion boards. Discussion boards is a great tool for our students to learn how to think through problems and goals. And as we were once students and currently are students, we use problem-based learning. We used it. It helped us understand the way we thought and helped us change some things that maybe we didn't understand, or maybe that we didn't quite get the understanding of, which was very good. Problem based learning, being that it is realistic and being that it does handle everyday goals, um, it evolves around everyday goals. That makes it very much more so easily obtainable. But sometimes, in order to obtain a goal and to gain a solution to a problem, first we have to be able to break down the steps in order to solve the problem. So having problem-based learning is one of the key things, or one of the focuses as for our students. It helps us as nurses determine what is the problem. When we can determine what the problem is, that's when we can go around um, solving the problem. We can't solve a problem until we know what the problem is. And then as we work through problem based learning, it helps us come up with ways to solve a problem, which is very important. Um, as we teach our students, ways to think it. And when we were students, we did the concept mapping and things of that. So what is the patient's problem? So it's very important for us to identify problems and then use the problem-based learning piece to help solve the problems and to become realistic in the goal and the expectations that we use. Now, um, my colleagues will now explain a little bit more about problem-based learning, and I hope I was able to captivate you and help explain that to you. Thank you. Have a good day. Bye.